What do CK levels mean for muscular dystrophy symptoms? Imagine a tiny alarm bell inside your muscles that rings when your muscle fibers get damaged. That alarm bell is called creatine kinase, or CK. When muscles are healthy, CK stays inside the muscle cells. But if the muscle fibers break down, CK leaks out into the blood. In muscular dystrophy, this leakage becomes a key clue for doctors. In conditions like Duchenne or Becker muscular dystrophy, the damage to muscle fibers is ongoing. Because of this, blood tests often show CK levels that are much higher than normal. Usually, normal CK levels are less than 200 units per liter. But in muscular dystrophy, levels can soar to 10 or even 100 times higher. This big jump indicates that muscle cells are breaking apart frequently, releasing CK into the bloodstream. The reason for this damage is a problem with a protein called dystrophin. Dystrophin helps keep muscle fibers strong and intact. When dystrophin is missing or not working properly, the muscle membranes become fragile. During normal muscle activity, these fragile fibers tear easily, releasing CK. In Duchenne muscular dystrophy, the mutation in the dystrophin gene causes very little or no dystrophin, leading to severe muscle damage. In Becker muscular dystrophy, the mutation results in a partially functional dystrophin, so the damage is usually less severe, and CK levels tend to be lower compared to Duchenne. Doctors use CK levels not only to help diagnose muscular dystrophy but also to see how the disease is progressing. If CK levels stay high or keep rising, it suggests that muscle damage is ongoing. If they start to decrease, it might mean that muscle mass is reducing or that the muscle damage is slowing down. But it's important to remember that CK levels alone don't tell the whole story. They need to be considered alongside symptoms, family history, genetic tests, and other assessments like electromyography or muscle biopsies. People with muscular dystrophy often experience muscle weakness that makes everyday activities like climbing stairs or running difficult. Over time, as muscle fibers die and are replaced by fat and scar tissue, symptoms become more noticeable. While high CK levels show muscle damage, they don't directly measure how well someone can breathe or how strong their heart is. Respiratory and cardiac issues are common in muscular dystrophy and need separate tests like lung function tests and heart scans to monitor. In fact, elevated CK levels can sometimes hint that respiratory muscles or the heart might be affected later on. But CK is mainly a marker of skeletal muscle damage. It's a helpful piece of the puzzle but not the full picture. Managing muscular dystrophy involves a team of specialists who look at all aspects of health. So, in summary, CK levels are a valuable marker for detecting muscle damage in muscular dystrophy. They help with diagnosis and tracking how the disease changes over time. High CK indicates ongoing muscle fiber injury caused by the lack or malfunction of dystrophin. But CK levels don't directly reflect respiratory or heart function, which requiring their own specific assessments. Always consult healthcare professionals for personalized advice and comprehensive care.